Electronic health records are intended to provide efficiency and accuracy in delivering patient care. New federal mandates require hospitals and other healthcare providers to adopt EHR technology in order to qualify for stimulus dollars and to avoid penalties later on. But as we're about to hear, providers need to choose wisely. Here to explain is Dr. Seth Guterman, founder and president of Empower Systems. Thanks for joining us, Seth.
Thank you for having us.
Also joining us is Christopher Elise, Vice President of Strategic Business Growth for Empower Systems. Welcome to you too, Chris.
Thank you for having us.
Dr. Seth, we're in what's considered a transformative time in healthcare. Why is that?
Jackie, it's both exciting and concerning at the exact same time, but what's mainly happening in the healthcare industry is we're transforming it from a paper environment to a computer environment. And to drive home our point, we brought you a patient's medical chart from just a 3-day stay in the intensive care unit. And the reason I wanted to drive home this chart is that this is how doctors and nurses communicate about patients' care. And as you can tell, if you look through the chart,
it is, sorry, scribbles everywhere.
Right,
this is hard to read,
right.
Horrible.
So Jackie, the exciting part is that we're now able to eliminate paper and move all medical records, all computer information related to a patient's medical care to a computer such as a tablet or iPad as we have here.
Wow. That's a snapshot of the whole record right there. Allergies, everything.
Right. It has your past medical history, your social history, your allergies, your home medications, your active medications, all the surgeries you've had, all your diagnostic tests, your blood tests, your CAT scan. It's basically, here's your entire hospital. Here's your entire office. And it shows you that you go from an illegible environment of sharing information to now we have a chance that patients and doctors can not only provide quality care, but fast care and customer service care.
So how relevant and important is this to the general public?
That's a difficult topic to discuss. To be honest with you, the 5th most common cause of death in America are medical errors. All right, and these are medical errors related to mostly handwritten medical information. To put it in perspective, you know what the #1 cause of death in America is, which is heart attacks. You know the 2nd most common cause of death in America is cancer. 3rd is strokes. 4 is clots in the lungs, and 5th is what they call these medical errors. Please understand, this is not malpractice. That's a separate category. A medical error is the inability to share a hospital to tell a doctor about a life-threatening blood test that's abnormal, or if a patient had a positive biopsy for cancer after a breast mass being removed, or if a doctor writes a medication and it's not legible and the pharmacist accidentally gives the wrong medication. To put it in perspective, and according to the Institute of Medicine, a government body, approximately 250,000 people die every year from these medical errors. 100,000 people die from car accidents in the United States every year, and approximately 36,000 people die from homicides. What that means, Jackie, is you, me, and even Christopher here are more likely to die of a medical error than we are in a car accident or in a homicide. So we have a unique moment in medicine, and the public is very much affected by this, because not only can we save thousands of lives, but there's something more awe-inspiring than that. And that is every hospital relieves pain and suffering. Okay, every hospital does, and you and with your own family members, as me with my family members, the question is how long does it take a hospital to do it? When you write a medication on paper, it can take 2, 3, 4 hours before the pharmacist knows what pain medicine you need. When you use a computer system that's designed correctly, within seconds, that pharmacist knows and nurse knows the morphine, in this case, that you would need, and it's delivered to you within minutes. So here's what's exciting. Not only can we save tens of thousands of lives with computers, but we can relieve pain and suffering to millions of people at the speed of technology.
Wow. So you've explained very clearly why the general public should care about this. Christopher, what about hospitals and physicians? Why should this be important to them?
Well, with government incentives and mandates coming down in the past year, it's a new time and a new opportunity for hospitals to make this move from paper to computers. Many have wanted to do it, many have intended to do it, and some have tried to do it, but the incentives are a true catalyst in this time.
Dr. Seth, explain who Empower Systems is and what you see as Empower's mission.
Sure. Empower has a unique business model. First of all, it's the only physician-owned company that's putting entire hospitals and doctors' offices on the same computer system. And that's vital because the way we see it, it should be one patient, one chart, one database, because that means it's easy for doctors and hospitals to share information within their community. And let me emphasize that, within their community. when Empower, or our company, looks at this at a national level, we're not just trying to make money, we're trying to solve the entire solution of how do we get all hospitals, both of those financially flushed with money as well as hospitals that are financially distressed, how do we create a business model that does that? We've done that a couple ways. First, most important thing is hospitals have spent millions of dollars of already installing these software systems. And there might be systems like laboratory systems, radiology, and pharmacy systems. With our system, the hospital doesn't have to replace this. What's great about it is our software sits on top of any existing hospital system, no matter whether they have a system from Meditech, Cerner, or McKesson. And what we are is we augment those systems that are not very good at getting doctors and nurses on computers. What's unique about our system, because it was designed by doctors want to use it. In fact, we're the only company saying that we'll guarantee that it's our job to get the doctors excited about computers, not the hospital administration. The next piece of this mission of ours is how do we make it a win-win for the patient, for the doctor, for the hospital, and for ourselves. So as we looked at this at a national level, and again, we want to be able to market or create systems for the financially flush hospitals, those with lots of money and those that are financially distressed. We looked at this both we need to come with a business and a technology solution. So our business model is this. If you looked at doctors' offices, they barely make any money, which means they can't afford to buy these computer systems. Most cannot. We know a third of hospitals and doctors are making money, but 2/3 are either breaking even or losing money. So that means 2/3 of hospitals and doctors' offices can't even take advantage of this incentive money, this $20 billion from the Obama healthcare plan. So what we came up with is that the hospitals buy the software and they give it to the doctors' offices for free or for a nominal amount of money. The second part of this was how do we solve the technology issues? Doctors' offices don't have an IT infrastructure. In fact, the IT guy is typically the doctor. So we designed an IT architecture where the hospital, who does have an IT infrastructure, they maintain the software, the database, the backup, the interfaces, and doctors' offices only need two things. They just need computers and high-speed internet. So when we look at this at a national level, we have a business model where the hospitals buy the software, doctors' offices get it for free, and two, the hospital who has an IT infrastructure maintains the database, maintains the interfaces, and doctors really get to focus on practicing medicine.
When Empower came around, it changed the whole dynamic. I noticed that, number one, I get here first thing in the morning and I see everybody. I can review, and this takes me only about 15 to 20 minutes. That's for about 30 patients. I will review what the other physicians have written about them. Like at the end of the day yesterday, I'll review any of the late tests that were done, any early morning blood tests that are done. They're all on the computer. It's all on Empower. So basically, I will sit down at a desk, take about 20 minutes, and go through each one of my patients. I am not impeded by patients going for tests. I am not impeded looking for a chart. And so Empower has made my life so much more efficient. My rounding is done so much faster, so much quicker in the day. Many times I will tend to have to go back to check on people later in the day after some certain tests. It's very easy to add a second note. My life as a hospitalist has become so much more simpler than it was prior to Empower.
I know you're a physician and I know you're highly recognized in your field. What perspective does your professional background offer here?
You know, it's been the catalyst, for this entire program. It's fascinating. When I graduated medicine, I realized that if a patient was about to die, I could actually deliver great quality and fast care. What became very clear, though, if 20 people present, in my case in the emergency department where I'm a board-certified emergency physician, if 20 people came, the whole system broke down because it was all on paper. Because how do you share information in real time with multiple people in the hospital, with multiple nurses, with the laboratory systems in a paper environment? So very early on, we started designing systems for doctors and nurses, and what's been fascinating was that when we were done, we were the first emergency department to have the entire emergency department, all the doctors' documentation, all the nurses' documentation, fully integrated 24 hours a day, 7 days a week. What was also very nice, shortly after that, one of the government organizations or affiliated organizations called Joint Commission published an entire chapter on our software.
Oh, wow.
And they called us a success story and role model. And their main reason for calling us a success story and role model was because we were able to guarantee 100% compliance on documentation issues. In other words, clinical information that's very relevant to the care of medicine and care to the government. And once that started, it made us realize that, hey, the same tools and methodologies that we did in the emergency department, we were able to roll out into a hospital-wide system and into doctors' offices and be able to personalize it to each of the individual hospitals, surgeons, pediatricians, obstetricians, et cetera.
You know, it's frequently said that physicians have to take the lead in the adoption of EHR. Do you agree?
Absolutely, and if you were to ask me why does the healthcare industry lag behind such as the airline industry and the telecommunication industry, it's because we've had no physician leadership or very minimal. And mainly because my colleagues and I were trained in one thing only. We were trained to deliver clinical care to one patient, one at a time. We were not trained to build computer systems. We were not trained to implement them in complex hospital operations. If you want to understand why healthcare is so far behind the business world as far as going on computers, you have to step back for a second. You got to remember, my colleagues and I went through medical education for approximately 12 years. In those 12 years, we learned how to manage a heart attack, deliver a baby, fix a broken bone. But here's what people don't know. At the same time, we learned how to document that information and communicate that information. Communicate it between doctor and nurse, doctor and pharmacist. The point is, Jackie, was 12 years of complex communication systems that took us to learn. How can some 25-year-old IT guy or geek learn that workflow? It's just impossible for them to do. So physicians really need to step up to the plate, because you remember, the electronic health record is the practice of medicine.
It really is.
Right, and I think we forget that. So why would we outsource the practice of medicine to an IT department or to a company where physicians are not designing and leading? Please understand, we need IT's help through this process. We need everybody's help. We need the hospital management team, the business office, everybody, but the physicians have to lead this because our complex communication and documentation systems.
Sure. You know what you need, and
Right.
you know what you need to see to be able to operate and quickly to function.
And please don't mistake our words for arrogance. It's just confidence. As doctors, we went and learned this information. We're the best ones suited on how this should be implemented in the hospital setting and also in the doctor's office setting.